Hello, everybody, here in our webinar. Today, we will talk about some particular topic in English for English audience in our channel, and that is the temporomandibular joint. Hello, everybody. Some of you will be here live, and some of you will see the transmission in our web application. Today, I think is a topic that many people want to uh, to listen. Is regarding the temporomandibular joint diagnosis and therapy. Diagnosis and therapy. This webinar is a free webinar for people who want to understand this particular topic. Before to start the lecture, I would like to inform you that we have our web application. Our web application is I will share later the link. In our web application, you will see all this transmission we do live or we download on it. From now, the main transmissions will be in our web application. Our web application is a free application. It is nothing to pay. And you will see a lot of information there, and obviously a lot of courses we share in our web app. Okay, I want to start directly today with this particular topic that is T.M.J. Diagnosis and Therapy. This is a free webinar, and there is nothing to pay. And I will share a PowerPoint, and we will start directly the transmission in our webinar. T.M.J's diagnosis and therapy. Firstly, before we start, I would like to focus the webinar. Normally, we talk about the T.M.Js. T.M.J is just a joint, is a joint. My finger is a joint. Finger is connected with the hand. It's not just the finger, right? That is the main topic I want to introduce. When we talk about TMJs, we are talking about the craniofacial dysfunction. Remember that. And if we go over this, we will talk also in postural disease. But today we concentrate here. We concentrate in the craniofacial dysfunction. We will start the webinar just to start the presentation and T.M.J today. That is the point of view of our school, the M.P.R. International School. The concept that we think we have to study for diagnosis and therapy. And going ahead, as I told you later, first, sometimes we have errors in our diagnosis and treatment. And I will try to clarify, obviously, in my point of view, what is the error when we make the diagnosis and the treatment of the T.M.J. First, let's talk about craniomandibular dysfunction. That is not just the jaw, it's craniomandibular dysfunction. And that topic is very, very important to understand. And We start today talking about T.M.J anatomy. Let me show some slides about the T.M.J anatomy, and then you will understand why I am telling that about T.M.Js. We, in the joint, we have a condyle and a cavity. All joints in our body have a condyle and have a cavity. Obvious, temporomandibular joint have a condyle and a cavity. And why is the name temporomandibular joint? Because the cavity is in the temporal bone. If you see here, the cavity is in the temporal bone here. And the condyle is in the lower jaw. That is why we said temporomandibular joint. That's very important first topic to understand. That's the name, the temporomandibular joint. We go ahead with the presentation. The condyle have a special shape, and the most important thing is that is covered by fibrocartilage. The fibrocartilage, it's something deformable, and that's important concept we have to understand. I want to stop something here. That's very important. That is a special concept and physiology. The joint is covered with the fibrocartilage. If we have in here, if we go here, this part of the condyle is covered with fibrocartilage. What do I mean? Any pressure inside the joint deform the temporomandibular joint. Imagine, that is a very important concept. If we, any situation who increase the pressure inside the temporomandibular joint, any situation will deform the joint. Remember that concept, please. And we go ahead. We have into this particular joint, we have a disc which is divided in two parts. Two parts of the disc. One part is the upper part here and the lower part. Why we have a disc? Because the condyle, if there is not the disc, will go ahead the zygomatic arch. And that's why we have this particular disc. That concept is also, this concept is also very, very important. Very, very important. Okay, we go ahead with the presentation. As you see there, we call that central relationship. When the condyle, the jaw, is centrated, we call that situation central relationship, that situation. But the condyle move, go forward, back. You see here the disc. Let me show you here better. You see here the disc. The disc is here, concave, and here is concave. You see? Why? Because there is an anatomy problem. Condyle is in front of the eminence of the zygomatic arch. Remember that. During the movement, as you see here, during the movement, the condyle go and the disc follow the movement. And why that is important in physiology? That is very important in physiology. The movement of the condyle have to stop here in this particular point. And you see here, there is a ligament here. We call that posterior ligament. This ligament is stopping the movement of the condyle. Another particular concept for diagnosis. Sometimes this particular ligament is, we call that, we have a laxitude, it's lax, have not force to stop the movement. And the condyle sometimes is going here. I will make a draw here. Yeah? The condyle doesn't stop here, stop here in front of the is going more forward. And what happened? When it's going back, have to do some particular movement. We'll have to do this and this to go here. And we think that is a click. And that is not a click. This is a jump of the condyle because posterior ligament have a laxitude. It's lax, it's very flexible, cannot stop the movement. Imagine all these things, all this concept is very important for diagnosis. Click is just in coordination. In coordination, when for any reason we don't stay here in this webinar, it's very short time to explain all the causes, but sometimes we have an incoordination of the movement. Condyle and disc, they doesn't coordinate the movement, and we feel a click. But the click is not a disease. It's just a dysfunction. Remember that. It's just a dysfunction. It is a little dysfunction of movement. All these concepts I am telling you is very important for diagnosis, but also for therapy. Because sometimes we do therapy because we do not understand a good diagnosis in TMD, temporal mandibular disorder. Two different concepts. Sometimes I listen patients who say, I have a TMJ. No, TMJ, I have a TMJ. You have a TMJ. Everybody have a TMJ. We have a TMD, temporal mandibular disorder. This is the problem. TMJ is a joint. I am in a lot of groups of TMJ. I suffer for them, no? For the patient. They said, I have TMJ. Everybody has TMJ. I hope it's functioning well. But temporomandibular disorder is the problem. TMD. And it's very important to understand what is the problem of the TMD. What is the cause of the TND to go straight ahead to the treatment. Going ahead with the presentation. That's an important concept. You see this? I show this particular picture because it's a very important picture. Look at here. That is the condyle. That is zygoma. The same here. This is condyle, and that is zygoma, zygomatic arch. In the back of the joint, that means here, in this particular area, we have the most important area of the temporomandibular joint. It's called a retrodisc. And that part is arriving all the life from here is arriving all the life for the T.M.J. All the life. If for any reason the jaw is going back, imagine jaw is going back, is going into the most important area, who is the retroarticular zone, life for the TMJs. And also there, another particular concept. Any situation that is putting the jaw back, imagine that is the jaw, and we go in the jaw here, on the back, is affecting the vital area of the temporomandibular joint. Vital area. And there, that is another topic for another webinar regarding bruxisms. I don't want to talk about bruxisms now. But in that area, in that particular area, we have the most important receptors of the temporomandibular joint here. Any situation who increasing the pressure there, alarm to the central nervous system and start bruxisms. Remember, bruxism, it is not stress. Another particular concept. I will do a webinar about this. Bruxisms, it is not stress. It's a very bad mechanisms of defense. Remember that. And we go ahead with the presentation. If we understand that, we understand that we have a lot of concepts to have in the diagnosis of the disease. Now I want to show you, sorry about that, let me take a little water. That is live presentation, and I was talking a lot in my school doing courses this week. My students have to me talk a lot in my lectures, and when I arrived at the end of the week, my my voice is not perfectly grande person. Sorry about that. This is a dissection. Dissection. I will show you. This is a cadaver, and I will show you a dissection. This is a line where a surgeon do the first step of the dissection. All right. And we start to remove the first plane. We call that cutaneous plane. And then we go inside slowly, and we arrive to the deep plane of the TMJs. And here we have live the condyle, mandibular condyle. Obviously, this is a dissection. It's not a human being live. Is a cadaver dissection. And look at this. Another concept, very, very important. here is the auditory canal, and here is arriving the life of the temporomandibular joint. Temporomandibular joint. The life is arriving there. Any situation who push back the joint is making a stress to this particular zone. Remember that. And sometimes we feel the ears tap. We don't listen very well. That is why we have a retroposition of the condyle and it's pressing the, the, the channel there. This is flexible, very flexible. Let me go ahead, okay? You see the relationship between condyle and auditory channel. And obvious, also there, we have otolitis, we have equilibrium. Imagine any situation who is pushing back the temporomandibular joint is compressing the otolitis and is creating also balance disturbed. That's very important for diagnosis. And then I want to introduce you to something particular, who is the division of pathology. In our school, we make a big division in all medical disease. We apply these particular divisions. Division of pathology. And pay attention, please. To understand, it is important, this big division. The big division is dysmorphisms and dysfunction. Look at that. Pay attention in that two terms. Dysmorphisms and dysfunction. Dysmorphisms is alteration of anatomy. And dysfunction is something who have not a good function in any part of the body. Same is the temporomandibular joint. Dysmorphisms is short quantity of the problem. Dysfunctions, 95% of the problem. Something who is not allowing at the temporomandibular joint to work well into the joint. 95%. Obviously, if we leave the dysfunction longer, we will have a very dysmorphisms in the future. Going ahead to the presentation. This is dysmorphism, alteration of the form, alteration of the shape of the joint, for some reason. Can be a tumor, can be arthrosis, can be a fracture. This is dysmorphisms. In that situation, we can improve the situation. Very difficult to arrive to normalize 100% the problem. And this is, as you see there, a dysfunction. Change of the position of the jaw. 95% of the problems is linked with this. And I will show you a patient now. This patient who have a craniofacial or craniomandibular disorder, who is affecting cervical. The first thing that is affecting the T.M.J is cervical problem. this muscle hyperactivity. A lot of muscle hyperactivity is related with T.M.J, temporomandibular disorders. You see there. And the head deviated like this. Obviously, that situation chronically is affecting the posture. It's not stopping there. It's not stopping here. Slowly, slowly, it's affecting the whole posture. And occlusion. That's an important topic. The wrong jaw position is blocked by the occlusion, blocking that traumatic position. We cannot do only physiotherapy or manual therapy. We cannot, because that is working only with muscle. It's put in the jaw. Yes, you can do manipulation and centrate the jaw. When the patient close the mouth, the occlusion, turn it back to the wrong position. No, never do before the physiotherapy and the osteopathy therapy, never before to annulate that situation. Because if we do manipulation of physiotherapy, any technique, we are not talking about here about what is the best technique. Any technique will failure because when the patient closes his mouth, the jaw turning back to the wrong position. That's important concept for diagnosis and to understand the concept of therapy in our school. Jaw lateral deviation, you see there, blocked by the occlusion. This is making compression into the joint and is affecting the joint, creating T.M.D, temporal mandibular disorders. And the occlusion, a very dysfunctional occlusion in that case, because obviously also there, a very bad functional occlusion is worse. It's blocking worse the situation. It's blocking worse the situation. And that's very, very important to understand. We go ahead. Dysfunctional occlusion. And you see there, the defense is bruxisms. Look at here, it's very important. This is ceramic. Here, this is a ceramic. Here, ceramic. We cannot break the ceramic, but bruxism is destroying the teeth. The central nervous system is trying to defend, to unlock the jaw, because the central nervous system is understanding here is wrong for the jaw. We go ahead. Bruxisms destroy. And in that particular case, that chronic disease is broken, the disc. If you see here, this is a tomography. Here, disc is broken. You see this, the disc is broken. Chronic disease can create chronic dysfunction, can create as this dysmorphisms, broken the disc. That's important. Why? We have to make intervention early intervention to prevent intradisc alteration. Yes. And condyle deformation. And then symptomatology. We're talking about symptomatology. We have local pain, obviously. Local pain. We have also, in this case, click, block of the jaw, if it's chronically. We can have neck pain associated with T.M.J. We can have dizziness, headaches, general pain, postural alteration. When it's chronic, the disease can create postural alteration and chronic pain. All the symptoms, it's related with the T.M.D, temporal mandibular disorders. As you see, it's a complex situation. We cannot treat this with manipulation, with a click, clack, or massage to relax the muscles. That's not therapy. I am not saying you don't need it. You don't need it before another things. I will show the therapy. Okay, therapy we propose in our school. And then we arrive to the therapy. The therapy is deprogramming, reprogramming. We do deprogramming of the jaw. That means we annulate the occlusal situation. Then we do physiotherapy and osteopathy. And after that, we do the reprogramming of the jaw, the reprogrammings. Put the jaw centrated, and at the end of this, if we can, we create the functional occlusion. If we cannot, for economical reasons, for anatomical reasons, for any reason we cannot create a functional occlusion, we protect the joint forever. That is our concept in therapy. And then the objective who is decompression. We were talking before about that. Condyle meniscal synchronization. We create the synchronization of the condyle. Centrate the jaw. Progressive reprogrammation. Vertical neuromuscular dimension, and then functional occlusion. This is the program we normally do in our school. We teach our students. And bed is the bed is a tempo. The bed, this particular device is a thermoplastic device for any medical sciences. It's not just for dentists. Any medical science can use it to annulate the dysfunction. Very simple device. Obviously, you have to be trained to do that. No? But any medical science, doctor, physiotherapist, osteopath, dentist, any medical science can manipulate the bed to annulate the system. That is deprogramming. After that, jaw is deprogrammed. The programmation of the jaw will take 15 days a month. After that, you do the rehabilitation, physical rehabilitation, any treatment you need, physiotherapy, osteopathy, any treatment. And the bed device is still protecting. And the situations will not relapse. That's important to understand. And then, after that, we use the reprogrammer. The dentists have to do that. Okay. If you do not do the reprogramming, you can protect the joint with the bed. And the system is protected because teeth have not touching. And if the occlusion is annihilated, jaw is protected. And any treatment is protected. If you want to go ahead with the treatment after the physical rehabilitation, the reprogrammer for the dentist is the way. We found the exactly jaw position, and then after that, the last part is to create a functional occlusion with orthodontics, prosthetic, or both. If we cannot do that, we still protect the jaw with bed until the patient can do the rehabilitation. That's why bed is an important device. Okay, because it's deprogramming and protecting until patient is ready. Because sometimes dental treatment is very expensive, and not all the people can can have the treatment, or sometimes anatomically we cannot do that. Yeah? The bed is protected. And the conclusion, temporomandibular joint has a very different physiology. Remember that. Very different physiology, yeah, for the rest of the joint of our body. Yeah. Resist traction, no compression. We may focus the treatment in the following way locally. Deprogramming, then physiotherapy and osteopathy therapy, and then after that we will do the reprogramming of the jaw, and then after that the occlusion, if we can do the functional occlusion. If we cannot do, we protect the system with the bed. Okay, this is our app. I want to invite you to go to our app. Today is a free webinar, but sometimes we do webinar in our app only. If you register in our app, you have the link here to register in our. It's a free registration. You register on there. You can see all the things we do inside the app, free for everybody. Right? And obviously there is a lot of courses. No, if you want to to study with us, this is our academy. The web app is our online academy. Okay. Thank you so much for your participation, for the people who stay live, and for the other people who listen the registration later. And this registration will be later in our app. If you want to participate to the registration later, I will put the registration in our app. I will put the link in our social, and you can follow that. Thank you so much to be here. Follow us in our social. Follow us in our web app. That is important. Our web app is important. Follow us. This is the way you can stay in touch with us. Okay. See you in the next webinar, in the free webinar. Yeah? And have a nice weekend, everybody. I hope you enjoy this presentation. Yeah? And I will see you in the next presentation in our channel. Bye bye, everybody. Bye bye in our school is the web in the Web App Academy. And thank you so much to be here. Bye bye, everybody. See you next.